Hey guys, and welcome to How to Gastro. In today's video, we'll be talking about a very interesting topic, and that is gestational diabetes. So let's get started. So what is gestational diabetes? So gestational diabetes occurs when a patient suffers from high blood sugar levels during their pregnancy, which is also called gestation. But their blood sugar levels were otherwise usually normal before they got pregnant. So gestational diabetes is a disorder that usually occurs between the 24th and 28th week of the patient's pregnancy. So basically, from this definition, we get that gestational diabetes is when the patient experiences high blood sugar levels during their pregnancy for the first time. So before their pregnancy, they usually had normal blood sugar levels, but now they are suffering from these bouts of high blood sugar levels. And the onset is usually during the 24th to the 28th week of pregnancy. So now that we know what gestational diabetes is, let's take a close look at the causes of gestational diabetes. So during the pregnancy period, the placenta makes hormones such as human placental lactogen, which is also called HPL, and insulin counteracting hormones that lead to the buildup of glucose in the patient's blood. So usually their pancreas can make enough insulin to handle that, but in some cases their blood sugar levels will rise and cause gestational diabetes. So in this little image at the bottom of my screen, we see the relation between HPL and gestational diabetes. So as the levels of HPL rise, so do the levels of the blood sugar. So because of this HPL and as well as the insulin counteracting hormones, some patients may go on to develop gestational diabetes. So what are some signs and symptoms of gestational diabetes? So most patients won't suffer any severe symptoms, but some of them may suffer from fatigue, blurred vision, excessive thirst, excessive hunger, the excessive need to urinate, as well as snoring. So what are some risk factors for gestational diabetes? So usually our patient is over the age of 25. The patient suffers from high blood pressure. The patient has a family history of diabetes. The patient was overweight before she became pregnant. The patient gains a larger than normal amount of weight during her pregnancy. The patient is expecting multiple babies, such as twins or triplets, etc. The patient has previously given birth to a baby weighing more than 9 pounds, which is about 4 kilos plus. The patient has had gestational diabetes in the past during a previous pregnancy. The patient has had an unexplained miscarriage or stillbirth. The patient currently takes or used to take chronic glucocorticoids. The patient has polycystic ovarian syndrome, acanthosis nigricans, or other conditions that are associated with insulin resistance, and the patient is African, Native American, Asian, Pacific Islander, or has some sort of Hispanic ancestry. So these are all the different risk factors for the development of gestational diabetes. So how can one go about diagnosing a gestational diabetes? So gestational diabetes is usually diagnosed at any time during the pregnancy if one or more of the following criteria are met. So fasting plasma glucose of 5.1 to 6.9 millimoles per liter, which is usually about 92 to 125 milligrams per deciliter. A 1 hour plasma glucose of 10 millimoles per liter, which is about 180 milligrams per deciliter, which is following a 75 gram of oral glucose load, and a 2 hour plasma glucose of 8.5 to 11 millimoles per liter, which is around 153 to 199 milligrams per deciliter, following a 75 gram of oral glucose load. Treatment. So the first thing we can advise the patient to do is some exercise. So exercise lowers the blood sugar levels by stimulating the body to move more glucose into the cells where it is used for energy. Healthy dietary choices. So eating the right kinds of food in healthy portions is one of the best ways to control your blood sugar and to prevent weight gain, which can also put you at a higher risk for complications. Medication. If dietary changes and exercise aren't successful in dropping these patients' high blood glucose levels, the patient may need to start insulin injections to lower their blood sugar. So between 10 to 20% of women with gestational diabetes will require insulin treatment to reach a normal range of blood sugar levels. So now let's briefly talk about some of the complications that may affect the baby. So the majority of these patients will go on to deliver healthy babies, which is an excellent thing. However, if patients' blood sugar levels remain uncontrolled, there may be an increased risk for C-section delivery. And some of the complications that may affect the baby include excessive birth weight. So the high glucose levels in the blood crosses the placenta, which triggers the baby's pancreas to produce extra insulin, which will lead to the baby growing too large, and this is called macrosomia. It may also lead to an early preterm birth and respiratory distress syndrome in the newborn. So the patient's high blood sugar levels will increase her risk of going into an early labor and delivering the baby before the due date. So these babies usually have not fully developed lungs, which may go on and lead to a respiratory distress syndrome in them. So another complication is low blood sugar, which is called hypoglycemia. So many babies born to mothers with gestational diabetes will develop low blood sugar shortly after birth because their own insulin production is too high. And severe episodes of hypoglycemia in these newborns may provoke seizures in the baby. Another complication is type 2 diabetes later in life. So babies born to mothers who suffered from gestational diabetes have a higher risk of developing obesity as well as type 2 diabetes later in life. Untreated gestational diabetes may also result in the baby's death either before or shortly after birth. So these are all complications that may affect the newborn. So moving on, let's just talk about some complications that may affect the mom. So high blood pressure and preeclampsia, because patients who suffer from gestational diabetes also have a high risk of developing high blood pressure as well as preeclampsia, which is a serious complication of pregnancy that causes high blood pressure and other symptoms that can threaten the lives of both the mom and the baby. And future diabetes in the mom. So if the patient suffers from a gestational diabetes, they are more likely to get it again during a future pregnancy, and they're also more likely to develop type 2 diabetes as they get older, which means later in life. And that brings us to the end of this video on gestational diabetes. Thank you guys so much for watching. Please make sure to like, comment, subscribe, and share. Hope you found the presentation very interesting and informative. Please make sure to turn on your bell notifications so you'll be notified every time we have a new upload. And if you would like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.